Thanks, Eileen.
Emergencies can seem scary when they happen, but by being as prepared as possible, you can help.
My friend, he found me. I'm just thankful that he knew exactly what to do. He saved my life.
I'm very grateful that you're able to do CPR and you saved my life. Anyone could be a hero, could be a family member, friend, or coach. By learning and doing CPR, it can save someone's life.
The Heartsaver course from the American Heart Association will feature simulated demonstrations to teach you skills, ensuring hands-on experience and confidence in real-world scenarios under the guidance of the instructor.
Actions by people like you can really make a difference.
With the testimonies of real survivors, the knowledge of experts, as well as support from some helpful assistants. This Heartsaver course from the American Heart Association will teach you how to perform CPR, use an AED, respond to a choking emergency, and even help in the event of a water emergency or drug overdose. We're with you every step of the way, empowering you to join our nation of lifesavers.
Good morning, good afternoon to some. Welcome to our Heartsaver webinar training network. Thank you for joining us to start off the new year strong. Happy 2026. I hope the new year's off to a great start for you. It is for us, and we are so excited to have you here today. So, after the guidelines launch, which was in October of 2025, we sent some surveys out to better understand your needs. Hopefully you all gave us some amazing responses, and many of you did. This is going to be the first of a 3-part Heartsaver series based on your feedback. Today's session will give you plain language explanations of the 2025 Heartsaver science and course updates as it relates to Heartsaver class instruction, including highlighting some of the major changes that may affect your instruction. We'll also review key updates to the instructor manual and student workbook with an emphasis on engagement, enhancements, and format changes. So let me share some housekeeping items as first. So let me get here. So first of all, this session will be recorded and shared out today, we hope, with the presentation later today. So there will be a Q&A session. So submit your questions down there in the chat. We have a wonderful team of people that are going to answer for you. We may not get to every question, but we're going to try. Put your questions down there at the bottom of the screen. Questions not answered during the live session will be included in a follow-up email later within the week. We're estimating it to be. Due to the number of attendees here, and I think we're at a whopping over 6,000 that are here on this call. Thank you for being here. Audio will be muted, so we'll need to mute that. So before we jump into the framework of today, let me introduce our amazing speakers. So today we have Mark Terry, who has been active in the Kansas City Emergency Services medical system for many years in clinical, professional, and development and executive leadership roles. He played a critical consulting role in the development of our new Heartsaver course and is an active instructor. Welcome, Mark. Michaela Recker is our National Program Implementation Manager, a part of the American Heart Association team, and a Heartsaver instructor as well. Libby Ridenour is our National Marketing Communications Manager at the American Heart Association. Libby has been with the organization for 7 years and is focused on turning bystanders into lifesavers with her work to build our nation of lifesavers. We love that, Libby. Who am I? I am Angelique Brown. I'm the Senior Director of Business Development of Channel Sales. Many of you know me. Many of you don't, but I'm happy to meet you today. I will cross 9 years with the American Heart Association this March. Yes, 9 years. My role oversees and manages the team of training center account leads for you and for the domestic US. This team, who is also in the Q&A chat, happily answering your questions. Bravo to the account leads. Thank you for being here. And we also handle any external customer requests for training as well. So let me turn it over to Mark and Michaela as they share more about the science and course instruction updates that are more relevant to Heartsaver. Mark will share more about the science aspect, and Michaela will share more about how it affects the way you teach the course. So Mark, I'll turn it over to you.
Great. Thanks for the introduction, Angelique. I'm Mark Terry, a paramedic consultant from Missouri. So right now I'm coming to you from Central Missouri. And I'm here to walk you through several of the big changes to the American Heart Association guidelines that impact the Heartsaver course. There is a lot of information here, and I would invite each of you to get further information at cpr.heart.org for specific questions that you have. Today, we'll summarize several of the bigger changes from 2025. So let's get started with the CPR guidelines. There was a major change in the guidelines for infant chest compressions in 2025. As the science on CPR expanded, including with infant CPR, several simulation studies that were combined into systematic reviews and meta-analysis, and a multi-center registry study, these started to show the difficulties of achieving the needed depth of compressions with 2 fingers for infant chest compressions. The new guidelines emphasize the 2-thumb encircling hands technique for chest compressions in infants, and another option being the heel of one hand on the breastbone as more capable of reliably providing appropriate depth of compressions. Michaela, how is this presented in the Heartsaver course, and what are the implications for teaching this skill?
Thank you, Mark. I love how you just explained this because our students, they will ask why we took the 2-finger technique away. So as an instructor, being able to understand and explain the why behind that to your students is critical. From a curriculum standpoint, however, there's actually no change in the overall flow to this lesson. We still have our compressions video followed by a practice while watching infant compression video. And we're really excited. We get to show you quite a few clips from our new videos today, and we're going to kick it off with our infant compression clip.
Now, follow along with me as I demonstrate. Ready? Let's begin.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Awesome job.
Awesome. One key addition we do have is the practice while watching infant CPR segment, which you see displayed on your screen here. This comes immediately after our students learn their breath. And you will actually see this segment in our adult and our child lessons as well. And really, this is just giving our students more opportunity to practice. So they will go through 2 full cycles of 30 compressions and 2 breaths before they move on to the AED. And one final update in the infant lesson plans I want to share is we are now having students practice using the AED on an infant mannequin before they finish up putting it all together. Speaking of AEDs, let's turn it back to you, Mark, to share some updates on AED pad placement.
Great, thanks, Michaela. As we all know, automatic external defibrillators, or AEDs, are a critical part of effective response to a cardiac arrest. When considering locations for pad placement, start with following the manufacturer's recommendations for the placements and locations of the pads. A common placement for pads is to place one pad on the right upper chest next to the breastbone and the other on the left side of the chest underneath the armpit. Now, this is referred to in medical language as an anterolateral positioning for the pads. Another position, particularly with pediatrics, could be one on the front and one on the back of the chest. Medically, that's referred to as the anterior posterior position. Heartsaver training materials contain more information on this. Now, when placing the AED pads, these should be placed directly on the skin, which requires exposing the chest. There have been some questions that have come up about bearing the chest and particularly interference with underwire bras. You'll notice on the diagram the common locations for underwires from bras, and as that diagram shows, there's not a large overlap between the pad locations and where the underwire is commonly had. Additionally, in consideration of the guidelines, a simulation study was evaluated that didn't identify any issues with underwire bras and the pad placements for defibrillation. But moving the bra out of the way of pads is a reasonable approach, and that's included in the guidelines. Michaela, how is this shown in the new materials?
Thanks, Mark. We have added female mannequins and more female imagery into the course, which you will see displayed in our materials. And we have also added a practice while watching using an AED on an adult into our lesson plans, allowing students to go through the motions of placing those pads with the instructor on the video. I want to point out an instructor tip in this lesson plan. It recommends playing that practice while watching with your students through first before you invite them down to activate their AEDs. This just mitigates having all of those AEDs going off at once, which if you're an instructor, we've all been there, and we just love that instructor tip. You're going to see these throughout the manual, and as an instructor myself, I find them incredibly helpful and a great addition to our materials.
Moving on to another topic, drowning is a leading cause of death in children and a significant risk for adults as well. The new Heartsaver materials incorporate recommendations from the 2024 recommendations for drowning from the American Heart Association and the American Academy of Pediatrics. This includes a drowning chain of survival that was originally proposed in 2014 and which describes actions for high impact interventions for the prevention of drowning, recognition of distress and calling for help, providing flotation and assistance to distressed swimmers, and immediate response to the drowning victim after the drowning victim is removed from the water. Now, it's important to emphasize that concern for safety is paramount, and water rescue techniques require specialized training beyond the scope of the typical Heartsaver courses. And I want to include a quote from the guidelines to emphasize the importance here. That it's critical that rescuers take precautions not to become a second victim by attempting inappropriate or dangerous rescue responses. The safest method to initiate help during a drowning involves remaining out of the water, calling for rescue services, such as a lifeguard or EMS, throwing flotation material, and waiting for a professional to arrive. So the next slide. After removal for the water, the initial actions are to call for help and remain safe. Then, as the victim is removed, you can check for responsiveness and check if they're not breathing. If they're not breathing or not breathing normally, then it's appropriate to open the airway, give 2 breaths that produce chest rise, and then begin CPR with 30 compressions and 2 breaths. Now, you'll also notice that there's a couple of other grayed out recommendations on the slide. That's because these drowning guidelines were written for a wide range of trained rescuers. The ones that are shown in the darker font is what's appropriate for the Heartsaver community. It is appropriate to use the AED as soon as available, provided that the victim is not in a pool of water and has been removed from the water, and that you quickly dry the chest to allow the pads to adhere. So, Michaela, what are some of the teaching implications for drowning?
Thanks, Mark. We know that drowning is a leading cause of death for children aged 1 to 4 and a second leading cause of death for children ages 5 to 14. So it is absolutely critical to learn this education and teach it as an instructor. As an instructor, we want you to be able to explain that it is reasonable to initiate those rescue breaths prior to your chest compressions in the event of drowning. Looking at the curriculum overall, however, there is no change in how this is laid out. We have a great updated water competency and drowning video with discussion questions to follow.
All right, we'll move on to choking. Another significant change in the 2025 guidelines is the inclusion of back blows to be set for severe choking. This was based on a cohort study that showed back blows to be safe and effective in comparison with abdominal thrusts, and the guidelines valued consistent approaches for infant, child, and adult choking. The recommended approach for severe choking involves cycles of 5 back blows followed by 5 abdominal thrusts until the choking is relieved or the patient no longer responds. And this is for adults and children between the ages of 1 and 8. To do 5 back blows, 5 abdominal thrusts until the choking is relieved or the patient no longer responds, at which point CPR is then recommended. If abdominal thrusts are not possible for the adult or child, then this could be due to obesity, pregnancy, or if the choking person is in a wheelchair, then it would be appropriate to move the hand location up to the breastbone and provide chest thrusts in the same manner as abdominal thrusts, but pulling straight backwards instead of the up motion that's done with abdominal thrusts. So how's this demonstrated in the Heartsaver materials, Michaela?
Yeah, outside of that science you just described for us, Mark, the way you teach this lesson is no different than before. We have displayed a little snippet of the instructor manual where you can see the video that gets played, follow along with a guiding question and discussion questions to follow to help with student engagement. And we are excited that we get to show you a little clip of our new updated choking video here.
Stand firmly or kneel behind the person, depending on your size and their size. Put one foot in front of the other to give yourself a steady base and place one hand on the person's shoulder. Then, use the heel of your other hand to give them 5 forceful back blows between the shoulder blades. This will push air from the lungs, helping to force out the object that's blocking the airway. If the 5 back blows do not clear the airway, move on to abdominal thrusts. To give abdominal thrusts, stand with your feet shoulder width apart and one leg slightly forward, like this. Wrap your arms around their waist so that your hands are in front. Make a fist with one hand and place it thumb side against the person's waist, just above the belly button and well below the breastbone. Now, grab your fist with your other hand. Next, give quick inward and upward thrusts to the abdomen, making sure your thrust goes upward and not straight back. Thrusting upward acts like a cough, pushing the air out while reducing the chances of causing injury to internal organs. Alternate between giving 5 back blows between the shoulder blades and 5 abdominal thrusts until the object is forced out and the person can breathe, cough, or speak, or until they become unresponsive.
So there's also a change in the recommended response for infant choking. We discussed before that 2-finger chest compressions are no longer recommended for infant CPR, and this carries through for the response for severe choking in infants. The recommended actions include cycles of 5 back blows, but instead of abdominal thrusts, we replace that with 5 chest thrusts that are given by using the heel of one hand to press on the breastbone to compress the chest in a similar manner to chest compressions in terms of location and depth, but not necessarily the rate and the other guidelines for CPR. Again, to reemphasize, abdominal thrusts are not recommended for infants. Instead, we're using chest thrusts with the heel of one hand. So what's this look like, Michaela?
You said it beautifully, Mark. Exactly. We just want, as instructors, to ensure that students are using the heel of one hand technique for those chest thrusts. And we do have another clip to be able to show you all.
Begin.
Great, that video shows it so clearly. Now, let's move on to some first aid topics. As you know, severe bleeding is a life-threatening emergency requiring swift action for effective first aid to stop bleeding. The new Heartsaver materials include recommendations from the 2024 First Aid Guidelines, which was the most recent revision. And these materials are aligned with the Stop the Bleed campaign in the United States. The initial action to stop severe bleeding involves direct pressure. Notice on the graphic the use of both hands to press on the source of bleeding. It takes a fair amount of pressure to be able to stop a severe bleeding. If this doesn't stop the bleeding, then packing the bleeding wound with dressings and using a tourniquet are the next steps. There is a recommendation that commercial tourniquets are recommended over improvised tourniquets unless the responder has had specialized training. Another first aid action that are emphasized in the Heartsaver materials is the use of the recovery position. Now, if someone requires CPR, we place them on their back with their face up so that we can administer CPR. If the person has decreased responsiveness, so they're not responding to you, but they are breathing from a non-traumatic cause, they should be placed on their side. And this helps to minimize complications with the airway, particularly if the person vomits. Now, rather than going through a step-by-step description of how to make the movement, Michaela, would it be easier to just see it?
Let's watch a clip there, Mark. I do want to add, this is a new addition to our curriculum, so it is important that instructors know how to place someone in this position. However, we are not encouraging that students practice this on one another. We have this fabulous video that we will show the audience here now, but there's also a step-by-step guide in the student workbook for students to be able to reference. So let's go ahead and watch the video.
To do this, gently turn their head to the left, place their left arm at a right angle to their body, and put their right hand under their left cheek. Then, bend their right knee and roll them onto their left side. This position will help prevent choking if they vomit. Once they're in the recovery position, gently open their airway by tilting their head back and lifting their chin. Check to make sure nothing is blocking the airway and continue to closely monitor the person's breathing and level of responsiveness until emergency responders arrive.
As the opioid crisis continues, the Heartsaver first aid materials also include information on responding to opioid-associated emergencies. Naloxone is widely available and is safe to administer if there is a suspicion of an opioid-associated emergency, even if the specific agent is not known. And this can include a cardiac arrest situation. In the materials, there are a new CPR algorithm that incorporates the administration of naloxone after CPR has been started if opioids are suspected. So what kind of updates are there in the new materials for opioid-associated emergencies, Michaela?
I love how much we have expanded on this topic. As we all know, this is a large crisis in our society. Personally, this is actually my favorite video that has been added to our new curriculum because it further details the mechanics of opioid exposure in addition to naloxone more than we ever have before. In the video that we are actually going to show as well, we actually include 2 demonstrations of administering naloxone, which again, this is brand new. One demonstration is on a real person who is not breathing normally. And the second demonstration is animated with a person slouched up against the wall who is breathing normally. These reinforce that naloxone is critical in both situations. And I think let's have the video display that for us.
To administer naloxone nasal spray, first remove the canister from the box and peel back the tab to open it. Hold the canister with your thumb on the bottom of the plunger and your pointer and middle fingers on either side of the nozzle. Insert the tip of the nozzle into the person's nostril. Now, press and hold the plunger to administer the entire dose. After you've emptied the canister, remove the nozzle from the person's nostril and discard the canister into the trash. If the person doesn't respond within 2 to 3 minutes, or if they stop breathing, you might need to give them a second dose of naloxone in the other nostril.
Now, of course, there is much, much more information in the first aid sections of the new Heartsaver courses. This includes critical information on the recognition of stroke, a time-critical emergency, signs of mental health crisis, as well as repetitive stress injuries in the workplace. As always, there's additional information on the background science as well as the materials at cpr.heart.org. So, Michaela, what are some of the other features of the updated courses?
Yes, thanks for pointing out those new additions, Mark. They are exciting and imperative to our lesson plans. I personally love all the guided questions embedded in the first aid lesson plans. If you are an instructor, you're aware that towards the end of class, where we get a little video heavy in first aid, it can be a little difficult to maintain that student engagement. So these guided questions and discussion questions that are a new addition, great way to support that. And as an instructor, like I've said before, find them very helpful and a great addition. Another key difference that we have now included is first aid topics such as heart attack and stroke are both now in our CPR AED curriculum, ensuring all students, regardless of the course path, will cover these topics. We also have updated our skills checklists. And a big change you will see is we have moved removing gloves and using an epinephrine auto-injector as required practice. And now we are only testing responding to a first aid emergency and controlling bleeding and bandaging. Splinting remains optional. There is no change in that lesson. I want to bring attention to our fabulous new student workbook, which I absolutely love. We have condensed it, a 4-in-1 comprehensive resource, everything in a compact alphabetical order resource. This is so easy to be able to throw in your backpack, a medicine cabinet, a filing cabinet at the office. I love the way we have set this up. It is going to help less experienced instructors. It will increase engagement throughout the course, and it also standardizes our training. Another thing we have compacted is we have combined our instructor manual. So now we have one manual that covers both our Heartsaver First Aid CPR AED and our Pediatric First Aid CPR AED. Like I've been mentioning throughout our time together today, we have new guided questions with discussion questions, instructor tips, so much good stuff in there to refer back to as an instructor. We have expanded our practice opportunities for students. We've revised our first aid order, and we have expanded on our comprehensive instructor FAQ, which if you're an instructor, I'm sure you already have that bookmarked. I love referring back to that in class, and we have added more to that, which is very exciting. Well, that is all for us. Thank you so much, Mark, for explaining our new science and guidelines in plain language that us non-medical folks can understand. And we at American Heart Association are just so excited about our new guidelines and our new materials. And I have been fortunate enough to be able to actually teach our new Heartsaver course before, and I am just so excited about it. And I hope you all on the call are just as excited as we are. Angelique, I will pass the baton back to you.
Thanks, Michaela. I can't tell you, all the hearts and thumbs ups and claps are just giving us so much life. We really are truly excited. Thank you, Michaela. Thank you, Mark. As you can see, there's so much that has gone on with this course. We took what you said, we applied it. We hope you love it. Just keep on flowing. Let's give Mark and Michaela a round of applause. Let's throw some hearts in the chat, some thumbs up. Let's give some hearts in the chat for those answering your Q&As as best as they can. Look at that. All the love is here. Thank you so much. But before we close out, we're going to turn it over to Libby Ridenauer. She's going to give us some information on the why. AHA. Libby, are you there?
Yes, here I am. Thank you so much. Good afternoon, and thank you for having me on to talk about Heart Month. My name is Libby Ridenauer, and this will be my 8th Heart Month with the organization. But before we get started, I wanted to share just a little bit about my why. My dad had a massive heart attack and triple bypass about 2 months after I got married, heart quests, and got very into cooking healthy recipes during his recovery. He says all the time how he is grateful to be around and to be pawpaw to my son Porter, who's my other why. Porter is the first boy born on our side of the family in 65 years, and these two are inseparable. These two are my why because heart disease can affect anyone at any age, and the decisions we make today, like taking the stairs or adding more color to your plate or even learning CPR, can have a lasting impact on our health and the lives of people we love. So let's get into Heart Month. CPR is again the focus for the American Heart Association this coming February. Our theme is You Are the First Responder, and you can see here on the screen some examples of our marketing and key messaging. It's important now more than ever to realize that anyone can save a life. In every cardiac emergency, the real first responder is not always a uniformed professional, but often a friend, a family member, or even a stranger nearby who's prepared and willing to step in. Cardiac arrest can strike anywhere, at the gym, at the grocery store, even during your child's soccer game. I want to remind folks that ordinary people have extraordinary power. The message, you are the first responder until help arrives, is more than a slogan. It's a call to action. It's a reminder that our communities are strengthened by those willing to step up and take action for each other. Just because you don't wear a uniform doesn't mean you can't be a hero. In a cardiac emergency, anyone can be the difference before professional help arrives. And before I move on to the next slide, I just want to call attention to those are actual real first responders who are featured in that marketing. We're really excited and proud to feature them. Next, I want to bring attention to all the resources we have available in our 2026 American Heart Month Toolkit. These resources include suggested social media, newsletter copy, and helpful infographics like the difference between a heart attack and cardiac arrest. I know you guys get that question every time. CPR fact sheet and the American Heart Association CPR playlist, and about 27 others in this folder. I encourage you to take a look at these resources, excuse me, and consider utilizing them in meaningful ways with your audience. I'm also happy to share that the toolkit will be featured in the upcoming edition of the ECC Beat and will be online this week in both heart.org/nation and heart.org/heartmonth. All right, and one asset in particular I wanted to call out is the official Heart Month PSA. It's available in 30-second and 60-second options. So let's take a look at that 30-second version now. Ryan?
When a heart stops, the clock starts. You are the first responder until help arrives. In that moment, 4 minutes equals brain damage. 6 minutes equals too late. In an emergency, the first responder is you. We need you. And you. And you. Will you be ready? Learn CPR. Visit heart.org/nation.
Wow, what a fantastic PSA. Thank you, Libby, for that Heart Month sneak peek, and thank you for sharing your why. Hello, everyone. You are hearing the voice of Quade Childress, one of the product marketing managers here at the American Heart Association, and I get the privilege of randomly selecting 4 lucky winners to our different giveaways today. Please note, if you registered for the webinar, you have automatically been entered into the drawing wheel. We will have 2 winners for our first bundle and 2 winners for our second bundle. Let's check out the first bundle. For this winner, you will receive the American Heart Association backpack, a collection of our training supplies, and a pocket mask set. Be 2 winners. And for our next giveaway, you will receive the brand new branded American Heart Association hat, training supplies, and a pocket mask set. Let's head over to our wheel and see who that winner is going to be. All righty. Winner number 1. Congratulations, it's Melinda. Melinda, we will reach out to you via email directly to confirm your shipping address before mailing out your prize. All right, let's see who lucky winner number 2 is going to be for our bundle number 1. Teresa Blair, congratulations. You are lucky winner number 2. All right, folks, we have 2 more winners. Good luck. And lucky winner number 3 is it Cher? Am I saying that right? Cher. Well, we have your name down and we will reach out to you via email to make sure you get your prize. All right, folks, last winner. Good luck. And lucky winner number 4 is Aaron Nixon. Congratulations. We have your names written down. We will reach out to you via email and make sure that you get your prize. Well, congrats to everyone. And that concludes the giveaways. We will reach out to you via email. And up next, we have our Q&A portion. Angelique, the floor is yours.
In fact, we love winners. Congratulations to our 4 winners. Libby, thank you for that amazing presentation on our Nation of Lifesavers. Congratulations, winners. I'm going to invite Marissa Alanis from our Senior Marketing Manager to come off mute, and let's kick off our Q&A, Marissa.
Thanks so much, Angelique. All right, we have several questions from the Q&A chat that we're going to ask of our presenters. We want to thank all the audience members who are submitting a lot of great questions. So the first question that we have for our presenter, Mark Terry, is the following. Mark, for the new back blows for adults and children, should the head be lower than the chest like in infants, if possible, or should they be standing upright?
Well, thanks for a great question. There are no recommendations in the guidelines for adults for you to place the head lower than the rest of the body as for infants. From a practical consideration, this would be extremely difficult to do. You will notice that there's a slight leaning forward in the videos while the back blows are administered, and this is primarily to be able to provide some easier back blows from this. Keep in mind that back blows and abdominal thrust for the adult victim of severe choking is really for the victim who is conscious and able to respond. So you're augmenting their other activities, and so trying to do too much manipulation, like trying to place their head in a dependent position the way we do with infants, doesn't, from a practical consideration, doesn't seem particularly useful.
All right, thank you, Mark, for answering the question. All right, our second question is for our presenter, Michaela. Michaela, here's the question. I'm a new instructor. Where do I go to find instructor information about Heartsaver?
Thanks for the question, Marissa. First off, thanks for being interested in becoming an instructor. I love seeing our instructor community grow. If you are interested, we do find that each training center has their own system of sharing information. So we encourage you to reach out directly to them for more information on how their processes work. We do, however, have great resources on Atlas. If you go to cpr.heart.org/Atlas and navigate to training resources, and then you can click on course information. You can then select Heartsaver, and it will land you on the Heartsaver Instructor Resources page. I personally have this bookmarked. I would encourage you all to bookmark that page as well so you can find it easily. And here you can find all kinds of instructor resources that you can utilize to set up for each course.
Great, thanks, Michaela. Our next question is for Angelique. Angelique, can you please explain what the difference is between Heartsaver Total and Heartsaver Basic?
Sure. Heartsaver, they're both the Heartsaver are first aid, CPR, and AED. The Heartsaver Total, it's primarily for the students that are required. They're both required to take the majority of the course topics in the course path. If all the requirements are met, the course path results in a completion card, pretty much designated for OSHA requirements. So now the Heartsaver Basic gives the students a little bit more flexibility in their choices of modules in there. So the optional topics that are inside the course. If all the requirements are met, the course path gives them another course completion cards, but it does not meet OSHA requirements. I would say for any employee that needs to complete any CPR AED education, they should inquire with their employer on which topics they need to take to ensure that they take the correct course.
Okay, thanks, Angelique. All right, our next question is for Michaela again. Michaela, there are quite a few guided discussion questions in the Heartsaver Instructor Manual. We know that they can be helpful. Do you have to use all of them when teaching a class?
That's a great question. They are incredibly helpful, I agree. We do encourage instructors to use those guided questions and discussion questions just to keep the student engagement alive and well. However, they are not required to use all of them. You should be selecting the questions that you feel are the best fit for your learners and your audience during that course.
Okay, thanks, Michaela. All right, our next question is for Mark. Mark, the question is, apologize. Here it is. Okay. The new heel of one hand guidance for infant chest compressions is great for small hands, but not so much for students with large hands. How are you teaching hand placement for students with large hands?
Yeah, that's a great question. And this is a topic that's come up at the BLS and Heartsaver pre-conference workshop at the Cardiac Arrest Survival Summit in December as well. So before I go into the direct answer to the question, I think it's important to understand the rationale for the change in infant CPR that's in the 2025 guidelines. As we've just talked about, the guidelines recommend that the rescuer should compress the sternum using a two-thumb encircling hands technique or the heel of one hand. If the rescuer can't physically encircle the chest, it's recommended to compress the chest with the heel of one hand. One of the implications of this is that the nature of the question is for people with large hands, how do you deal with the small real estate of a relatively small breastbone, particularly on a small infant? The way the Heartsaver materials provide this information, it's to start with a two-thumb encircling technique. And then if you can't get your hands all the way around, or you can't reliably get the depth, then to convert over to the heel of one hand. Now, this implies that people with larger hands are more likely to be able to use the two thumbs encircling technique, which is one of the benefits of using that particular approach. But the guidelines allow for either option for that. The key element with the guidelines is that we try and concentrate the pressure on the breastbone and using the two thumbs either adjacent to each other or on top of each other. There's not a clear recommendation on one over the other, but to be able to concentrate it there or to use the heel of one hand. And this has been reinforced with some meta-analyses and systemic reviews of a large-scale simulation studies, as well as data from an observational registry in which there wasn't a whole lot of use of the two-finger technique, but where it was, there weren't CPR sequences that were compliant with the guidelines. So again, what this seems to be showing is that while we've seen this in the mannequins, and you as instructors have done great jobs in teaching this technique, the translation into more high fidelity simulations and the translation into real practice is problematic with the two-finger technique.
Thanks so much, Mark, for explaining that. So that concludes our Q&A, and now I'm going to transition back to Angelique.
Thanks, Marissa. Great questions, everyone. The ones we did not answer, we will have those out to you hopefully within the week. Thank you so much for being here on behalf of my team and all of the Heart Association and your training network, the training centers. Thank you for being here today. This has been incredible. From our heart to yours, happy 2026. Look forward to the next Heartsaver webinar number 2. It's coming up on February 25th at 12 to 1 p.m. Central Time. Keep in mind, we're always Central Time. So make a note of that. Look for the announcement. Ask us more questions. We are here for you. We're here to save more lives. Thank you for being a part of this nation of lifesavers. We adore you. Happy Wednesday.